What's up, everybody? Matty Willz checking in for yet another episode of Wellbeing Wednesday with Matty Willz, brought to you by the very fine people over at MetroHealth. And today we'll talk to an expert about an upcoming event that we want you all to be a part of. So without further ado, we'll bring Dr. Charles Modlin into the fold. How you doing, doctor?
Doing outstanding. It's April finally.
It's April finally, and we're what is it, a third or a quarter through the year already, which is just crazy to even think about. But we wanted to talk to you today because you guys are putting on a very important health fair real soon, and we'll get to that in just a second. But before we talk about that, I just wanted you to give a little bit of context to our listeners and our viewers about, sort of your journey into MetroHealth and exactly what you do for them now.
So I've been at MetroHealth now a little bit over 2.5 years. I'm a practicing clinical urologist. I'm also the vice president and chief health equity officer at MetroHealth. So a lot of what I do, in addition to seeing patients and operating, is to look throughout the health system and try to develop clinical programming and community outreach programming that will help us address and eradicate the health disparities that disproportionately, especially afflict people of color. Higher rates of high blood pressure, diabetes, heart disease, cancers are more prevalent in minority communities and individuals. And so that's my role and responsibility. So I'm working across the entire system with all 9,000 MetroHealth caregivers to develop innovative health equity program that is designed to improve the overall health of the community.
Perfect. And you do have a very important responsibility in that, because we know how important that is. And as we kind of creep into Men's Minority Health Month here, I know that you all over at Metro are putting on a health fair. So let's just kind of dive into that. If you can tell us a little bit about the Men's Health Fair and what are you hoping to accomplish with it?
So yeah, it's very important. This is National Minority Health Month, the month of April, all across the entire nation. And, we at MetroHealth are playing a significant role. As you announced, April the 27th, we're holding our annual Men's Health Fair, open to all men, regardless of race, ethnicity. And this is actually, by the way, the 20th year, so I'm very proud of that. But the role of the health fair is to break down a lot of the barriers that have historically prevented many men from accessing the healthcare system, from undergoing preventative health screenings, health examinations. This is a free event open to everybody. Even some women are encouraged to attend. But it's an event where we are conducting free health screenings, preventative health examinations. We're providing health education. And again, we're specifically trying to reach men, but even more so men of color, because men of color have the highest incidence of these healthcare disparities, just some of which I mentioned, that lead to a lower life expectancy, especially in Black men. Black men, compared to their white male counterparts, have about a 6-year shorter life expectancy. Wow. And a lot of that is due to the healthcare disparities that we observe. And again, we're addressing these healthcare disparities at our health fair, April the 27th. Again, we're going to actually hold that health fair at 2 simultaneous convenient locations. Okay. We're going to be at our Cleveland Heights Metro location, right across from the Home Depot and Severance Circle. And for the first time, we're partnering with Tri-C, Cuyahoga Community College, and we're going to be at the Tri-C downtown Metro campus offering these free screenings also.
Dope. So yeah, 2 simultaneous locations that'll help out in terms of, what area of the city or, just in general where you stay. So you have a couple of different options for where exactly you want to go. And, I'll admit too, for myself, a few years ago, and I'm 40, but a few years ago, I didn't have a primary healthcare provider. And it was actually through a lot of the conversations that I've had with you guys over at MetroHealth that I actually chose my primary health care provider with MetroHealth. So these health fairs do hold a significant weight to people who may be on the fence, and I'm a testament to that. And doctor, you kind of touched on this a little bit, but if you can dive just a little bit deeper, why? And I know you mentioned my wife will be happy that she can attend the health fair, but why are we reaching out specifically to men?
Yeah, so men historically, in many situations, have ignored their own health concerns, taking care of themselves. It seems like at an earlier age, women have been educated, even as young girls, the importance of going to the doctor to get a routine health check, but for various reasons in our society, many men, I know when I was growing up, if you fall down and get hurt, scrape your knee, don't cry. The first thing they tell you, you better not cry. You have to, you learn to be stoic, to be macho. And unfortunately, we internalize that type of behavior or approach to our own health. There are many very serious and important health conditions that we can treat and cure, but we have to be able to diagnose those conditions in early stages. One example is prostate cancer. Most cases of prostate cancer are diagnosed in men who have absolutely no symptoms whatsoever, diagnosed through a simple blood test. And we do know that prostate cancer is equally treatable and curable in Black men as it is in white men. Unfortunately, a lot of Black men present in later stages, and that's why the incidence of death rates from prostate cancer is twice as often in Black men as in white men. So prostate cancer is one of the screening tests that we're going to be screening for at the health fair. You mentioned that you're 40 years old. That's very young. But that is actually a very important critical stage in a Black man's life. And I say African-American man because Black men should, the national recommendations are that Black males should start screening for prostate cancer at the age of 40. And in contrast, white men, unless they have a very strong family history, don't have to start until age 55. So You're right at that age where we need to get you in and start checking your PSA, simple blood test. It's called the prostate specific antigen. We don't have to always do that exam that the guys are fearful of, that prostate finger test. We don't have to do that. In most cases, come in and get a blood test. We're going to check your blood pressure. We're going to listen to your heart. We're going to check your BMI, your body mass index. We're going to check your urine to see if you have any blood in the urine that could signify kidney disease or bladder cancer, kidney cancer, et cetera. So again, we're doing these screenings. They're all free from head to toe. We have 650 MetroHealth volunteers. We have every specialist that you can imagine that will examine you from head to toe, answer your questions. April the 27th between 11 a.m. and 4 p.m. It's an opportunity you want to take advantage of.
That's right. Mark on your calendars, April 27th, the Men's Minority Health Fair, and the Men's Health Fair for Men's Minority Health Month, put on by Metro, partnering with Tri-C this year as well. We'll have all those good details for you down below in the caption for this post. And yes, you did mention a couple of things that my doctor has mentioned to Dr. Marcus Germany. Shout out to him, actually. I think he's moving on. I actually have to find a different doctor, but that's a different discussion for another day. But he's been, very open to me about my age and the things that, I should start doing now and getting ready for. So, I listen to my wife, so I'll just do whatever she says and whatever my doctor says. I think is probably the best advice I can give to anybody. But we'll get you out of here with this, Doc. Why is it important for men of color to go to the Men's Health Fair?
Well, really, this month, National Minority Health Month, we emphasize the importance that men of color, women of color go get a health check. But again, the reason there is a Minority Health Month is because there's a greater burden and a greater incidence of disease states, chronic health conditions that we see in Black and brown populations, and especially in Black and brown men. Black men have the shortest life expectancy out of any group in the entire United States. And a lot of that is preventable through preventative health screenings, early detection of disease. And one of the reasons why we're doing this, again, because of these statistics, these stats don't lie. But we also want to emphasize to the men that they matter. Black men, you matter. We care about you. We're here for you. We understand there are a lot of barriers that have prevented you from gaining access to the system. We actually, this is a free health fair, April the 27th. And again, what distinguishes us from many health fairs that are out there, and they're all great, but what distinguishes us at Metro is that if we find an abnormality at the health fair, the Men's Health Fair, we actually will provide a way for you to access the system so we can actually treat that condition, whatever it is that we find. Our health fair is not designed to take you away from your existing healthcare providers, or if you go to a different healthcare institution, we're going to provide you with additional health information, maybe that you haven't received. The results that you get, we're going to get you the results you can take back to your respective doctors' health systems. But also, we want you to know at MetroHealth, we are a point of entry and access center, medical institution whereby you can access your care with us. But that's not a requirement. So again, come to the health fair April the 27th. That's the last Saturday in April, 11 a.m. to 4 p.m. We're here for you. We have all these volunteers lined up, and we're ready to go. So we just need you to show up. You can pre-register at metrohealth.org/MMHF, or you can just show up on the day of the event, and the registration takes probably 60 seconds. So we'll look forward to seeing you there.
Perfect. Yeah. And, you touched on a lot of really good points there, but I just want to kind of emphasize that you guys aren't trying to sell a product. You're not trying to do, just put your name out there. You're just trying to help people. And that's what it's all about. So whether you have a regular doctor or not, come check out this free event and get your health screenings done. Register for the event at metrohealth.org/MMHF, or just show up. MetroHealth will be at 2 places this year, as the doctor has stated: Cleveland Heights Medical Center and Tri-C's Metropolitan Campus. The health fairs start at 11 a.m. and end at 4 p.m. on Saturday, April 27th. You can also call 216-957-3862 to register or to get more information. And I know I just said a mouthful, but all of that information will be in the caption as well. So Dr. Charles Modlin, again, thank you so much for taking some time out of your day, imparting these very important words for us. And, I'm sure we'll talk again. I can't believe it's been a year already since we spoke about this very same event last year. But, when you get up in years like me, time seems to go just a little bit faster. But thank you so much again. Did you have anything else that you wanted to touch on before we get out of here?
No, I'm just looking forward to seeing everybody, and please spread the word. So thank you for having me.
Absolutely. And you just reminded me, share this video. If you're not in the area anymore, if you know somebody that you think needs to go to this event, send this video to them so that we can see them there, and we can all get healthier, we'll say, for the new year. Well, it's not a new year anymore, but you know what I mean. So he's Dr. Charles Modlin. We'll talk to him again soon, and we'll see everybody at the health fair coming up. Take care.
Okay, thank you.